It's so good to be here with all of you. I was just looking up as folks were giving these wonderful remarks. I was just trying to figure out when the first time was that I had the opportunity to have a conversation with folks in New Jersey about student basic needs. And I realized it was a very different day. It was February 27th, 2017. And I was invited to, I had just moved back to Philadelphia from Wisconsin, and I was invited to testify in Trenton, because we had a hearing, finally, about food insecurity in higher ed, and I was looking at those recommendations that I had the opportunity to make that day, and the top recommendation that I made that day was that we create community of practitioners across the state who would work together on these challenges. And so thank you so much, Secretary Bridges, for making this happen, and to your team, and to all of you for taking this seriously. I can't tell you what a dream it is to hear words like, this is a central issue for college students, and that this is an important thing that we take on, because for a really, really long time, it really wasn't this way. Right? I got into this work because students told me that they were struggling to eat, and they were struggling to have a safe place to live, and they didn't think anybody knew about it, and even more importantly than that, they really didn't think anybody cared. So you all are evidence that in New Jersey, you do care. And I'm going to take the opportunity, a little time with you here this morning, to not try to convince you that it's important, because I think that we know that now. I'm going to do my best to equip you with the latest science and the latest information that, at least from my perspective, and I have the privilege now of working with organizations all over the country to understand what they're up to bring you some ideas and some reason to keep pushing forward. All right, so I don't know if I'm advancing the slides. I think I am. That's not the right way, so we'll try that again. Okay, so I want to underline the point that basic needs security is important, but first, because I think that the way that we do this work matters, and the way we do this work is affected by our understanding of what higher education is for. I want to talk for a moment about what that purpose is. And I think it's a really important time to be talking about that, because there are so many people who are questioning the value of higher education, and so many people who, I would argue, are rightfully unhappy with what it's costing them. Not just in terms of money, but in terms of time, and in terms of their self-esteem, some of them, and the way that they feel that they've been treated by a system that hasn't always included them. I believe that higher education, and I think we're going to have increasing scientific evidence on this, is about way more than the economy. I think it is important, and many of our students are here, of course, to achieve, if not financial mobility, financial stability, right? The very idea that you could just count on being okay from month to month. But I also think that we have to recognize that this is about more than individuals trying to get a better life for themselves. They're trying to get a better life for their families and for their communities. And also, they are there because education is one of the few things that people cannot take away from you. And there are so many who've lost so much. We've seen enormous lessons about that in the last 5 years. Education is one of the things that no one can take away from you. Once you have it, you have it. And it can, and many students have spoken to me about this being the reason that they stay enrolled, even when they don't have enough to eat, why they choose to buy their books instead of paying rent. Because education, when done right, can be liberating. And so I think that as we address students' basic needs and as we talk about how we do that we think beyond the economic returns to college, to think about what it means to promote their liberation and also their thriving. I'll talk later on about some of the latest science that we have that also suggests that even concretely, we're able to see that addressing students' basic needs and helping them in college actually improves their health. And that has its own type of ROI. So becoming more effective requires, I believe, that perspective. Now, another thing that I just want to really make sure that we all understand is that addressing students' basic needs is not about doing something in the non-academic part of students' lives. It is about directly intervening in the academic part. I, over the last several months, have had one of the biggest privileges in my entire life I've started teaching as an adjunct at the Community College of Philadelphia. I have 36 lives entrusted to me for the semester. They range from ages 16 to 36, and I'm teaching them Introductory Sociology 101, the very start. And I have to tell you that I entered that classroom knowing what I know from all my years of research and from also teaching in university settings, knowing that if I wanted their eyes on me, if I wanted their energy to be there, that I better bring some food with me, right? And it's not just, I'm not talking free pizza or whatever else, right? I walk in to every single class with a bag over my shoulder that has a range of snacks in it. And I put it out right at the start of class to make sure that they have something in their bellies so they can focus. And I was warned at the very start of the semester, I was warned that while I might think that my number one goal was to teach them sociology, in fact, my number one goal was to make sure they were all there at the end of the semester, still enrolled, because that is an enormous challenge. And I know that from research, but now I really know that. And I gotta tell you, I still have 36 of them, and I only have 3 weeks left in the semester. And I think that I've got 36 of them because as much as I care about my lectures and as much as I've been putting together engaging class activities, I see them as human beings first, okay? So I just think it's really important the way that we talk about that. It's not a non-academic issue. The more that we say that, the more it also helps fellow teachers. It helps us understand why this isn't our jobs too. And it can't just be the work of advisors. It can't just be the work of staff. It has to be the work of professors, whether you're an adjunct or whether you're full-time and tenured. And it has to be that way because we now have really robust evidence from both states like yours that have collected data and institutional data, but also from the federal government, that basic needs insecurity is a problem everywhere. It took a really long time for us to get this information. And for those of you that haven't seen it, I hope that you will pay attention to it, and I hope that you will speak up to help us keep having these kinds of data. It took a lot to get the US Department of Education to agree to ask students if they were okay in these areas. And we started by doing surveys. And in fact, Bergen Community College was one of the first schools in the entire state of New Jersey, and in fact, the entire country, to do one of those surveys. And then we got some states to do them, and that's wonderful. I really want to thank all of you for participating in the Real College Survey years ago. And we took that initial evidence, and we said to the federal government, you all have more money than anybody else. And when I do surveys, I usually do them on a budget of maybe $150,000, but you do it on a budget of $20 to $30 million. And that means you can get students to respond at high rates, and that also means that you can get institutions who are not like those in this room. Institutions that really were invested in saying this is not a problem on our campus. We do not want to collect this information. They get them to participate. And so now we have nationally representative data. It was collected in 2020, and take that with all of the caveats, right? That's why we need more data from 2024, 2028, and so on. But we can see basic needs insecurity in all of our sectors. The data are available on the NCES website. If you look up NPSAS, NIPSAS, you'll find it. You can run it yourself. They actually have a wonderful data lab making it very accessible. And I just learned yesterday that the restricted use data has come out. I'm saying that for any data geeks in the room who have been eagerly awaiting that like it was Hanukkah. So let me just say a little bit about what we learned from those data. The data show us that when they asked students about food insecurity and whether they experienced it in the last 30 days, and that is a battery of measures. It comes from the US Department of Agriculture. 23% of those students experienced food insecurity. Now, you might be asking yourself, are our rates higher here in New Jersey? You're going to hear from the research team later today, and what I will say to you is maybe. The one key, though, is that oftentimes when the rest of us do surveys, not the federal government, we really have a hard time getting response rates to be above 10%. These folks got a response rate upwards of 65%. So it is possible, right, that their data are more legitimate, more valid in some way. But also, what we know is that the rate of 23% is across the entire nation, across all types of colleges. So it is also possible that it just really is higher here. And you can see from these data that this problem is at community colleges, and it is at public four-year institutions, and it is at private nonprofit institutions. What you don't see here, and that I have published on now, is that it is even higher at for-profit colleges. And I think that's incredibly important because for-profits represent a sector that until this point we had absolutely no data on. I will also tell you that a lot has been written about the inequality in funding for higher education. I remember years ago being on a task force at the Century Foundation in New York about community colleges. And one of the examples that we used for talking about inequity in higher education was New Jersey. They compared the public funding that was going to Princeton University to the funding that was going to the rest of y'all. And that disparity might imply that places like Princeton don't have basic needs and security affecting their students. But I can tell you from looking at the data that they do. It's everywhere. And so we don't need to act with any sense of shame that this is happening to our students. What we need to do is understand that we're all in this together, that it's coming from a set of largely structural problems, and that therefore the way we're going to solve it is both to act locally but also to act together. The other thing that you can see on this slide is I've given you just two racial groups to look at, and there are so many more available in the data, but I really wanted you to see just the stark comparison between black students and white students. Just as in the broader American public, there are plenty of white poor people. But my goodness, are black students in this country affected by basic needs and security? In fact, it really staggers me that we've been talking about the black-white gap in college completion for decades and not talking about the fact that 35% of black students nationwide are affected by food insecurity. I mean, how in the world do we propose to address those gaps without addressing those issues? The data are incredible in terms of their detail on various groups that you might be interested in, and so here I'm going to switch to homelessness for a moment. This measure of homelessness shows that 8% of students in that nationally representative data had been homeless in the last 30 days. Now, I had typically prior to this time been reporting rates of around 10 to 15%, and I want you to know that my measures had always been over the past year. This is just over the last 30 days. Okay, so we would suspect a year-long measure to be even higher. But we can see, for example, that 7% of students working full-time while in college were experiencing homelessness. We can see that 9% of those enrolled full-time were experiencing homelessness. And we can see, as has been very clear for quite a while, that students who identify as genderqueer or nonconforming have much higher rates of homelessness. So do students with disabilities, a group that we don't say nearly enough about in this space. And those, and this is an interesting thing, I've talked a lot about foster care to college, and many of us have worked on this issue. The national data, unfortunately, did not capture the foster care experience well, but they captured two related groups, orphans and wards of the state. And 14% of them had experienced homelessness while in college, which is devastating because their odds of getting to college in the first place are so incredibly low, and it is such a shame that they would then experience these things while on our campuses. Now, Secretary Bridges noted, and I don't want to scoop anybody, that there have been prior surveys to date, so I'm just going to talk about a couple of past ones here in New Jersey. The one that my team led in 2019 identified higher rates than the national average for food insecurity, housing insecurity, and homelessness. For those who haven't heard me talk about these things before, housing insecurity, what I want you to think about is these are folks who are at risk of becoming homeless. Unless we do something proactive, these are folks who are finding their bills to be too high. They're not paying them on time. They may not have all their utilities on. They're living in doubled up conditions. They're moving often. These things are greatly negatively correlated with academic outcomes. And homelessness is sheltered or unsheltered homelessness. And so what I mean there is you shouldn't necessarily picture students sleeping on the street or in tents. Very few college students are in those circumstances. And they're not really, for the most part, sleeping in their cars. What they're doing is couch surfing. And, you know, there is this popular image that couch surfing is about hanging with your buddy who you just want to sleep over on Friday night because you were out too late partying. But couch surfing is really much more about staying on one friend's couch one week and on a cousin's couch another week and being told that this is not your house. and that you are not to be using the electricity, and you are not to be opening the refrigerator, and you are not to bring your friends over, and so on, and so you really can't settle in. And you're often trying to sleep on a couch, so you're not getting a good night's sleep. And so I don't think we need to get into which type of homelessness is most severe. It's all bad. The COVID survey found even higher rates here in New Jersey, and I'll be curious to see what we see today. So let me tell you some good news. The good news about today versus in 2017 is that the landscape of basic needs supports is rapidly expanding, including here in New Jersey. And I'm going to go through a couple of slides to highlight the variety of supports, because I don't want you to just think about food pantries. Okay? I don't want you to just think about emergency aid, although I'm really glad that so many of us got experience with emergency aid during the pandemic. And I can't say enough thanks to the federal government for finally stepping up and believing students that sometimes you just need cash fast. That's great. But the most important basic needs supports that we're putting out there are coming through basic needs centers, because basic needs centers tell students this is a thing and we care about it. My very good friend Keith Curry often says, if you want me to understand your values, show me your budget. Right? When we have a basic needs center and we're putting some physical and virtual space behind this and some staff, we know it's serious. And the things that need to happen in basic needs centers include things like social work-informed case management, the co-location of services so that students can essentially one-stop shop for various supports. In terms of food, you'll notice that the first thing on my list is SNAP. Yesterday, or 2 days ago, I ran a piece in Diverse where I have a new column, and I explained that we have a wonderful opportunity in front of us right now in higher ed to be able to bring more money to our students without spending our institutional dollars, and that is by getting involved in the Farm Bill. Because right now, it's going through a reauthorization, and this is our chance to make it easier for students to get SNAP. SNAP is a way for people to eat with dignity. It is a way for people to go to the store by themselves or with their child and be able to shop and get the food that they want near their homes. They don't have to come to campus and take a bag home with them. We need to expand SNAP access for students, and we need to also expand the amount of the SNAP subsidy for everybody. Meal vouchers, I'm going to talk a little bit more about that in a little while because it's a promising practice. Free meal programs that are starting to show up. Some of those are partnerships. For example, Every Table is one company that's been doing a lot of good work with colleges. And I would really like to see those kinds of programs expanded through federal changes, which would include an expansion of the National School Lunch Program to higher education. On the housing side, we're seeing a variety of innovations. They range from vouchers, which give people, for example, a discount on the housing on the private market, to place-based subsidies, where we have buildings that are being created for college students that are more affordable, or even have free housing for students who are homeless. Rapid rehousing initiatives at local community partnership style. That can help students who really can't either locate the affordable housing or don't have the initial security deposit or the first and last to put down. Utility assistance. Really want to triple underline that. It's a very weird November day to be talking about this, but heat is a thing. And a lot of our students, you really would not believe, get this nasty surprise starting around December, where their heating bill goes up. And they don't have it. They don't have the money for it. And if they were enrolled in the federal program known as LIHEAP, which is under-enrolled all over the country, they'd be better prepared to be able to afford those bills. There are also a variety of energy companies that also offer emergency assistance, meaning cash that you all don't have to pay for. And we are seeing a growth of off-campus housing partnerships. One of them I'd like to highlight, and it's not just because I'm working with Education Northwest, I promise, but there's an organization called College Housing Northwest. And what I love about this organization is that it's blending and braiding public and private funds. So for example, during the pandemic, the state of Oregon began to say, we want to convert some hotels into affordable housing to support people who are homeless. And what those folks did was they went and advocated for some of those funds to be made available to create a building, a conversion, that would house homeless college students. In addition to that, they're redoing their business model. They actually develop and maintain properties as a landlord, and they're developing a better business model so that they can provide more subsidies across the board. Imagine if you could convince someone in New Jersey to do the same. Other things that we're seeing happening: transportation, incredibly important, right? Students not coming to class. Yesterday I had a student, she said, "I'm not gonna be there today. I lost my SEPTA card key. I'm waiting for my mom to get me a new one." I have to admit, I was torn between Venmoing her the money to just take the train in that day, and knowing that it was important for her to get that card key. We're seeing a variety of public transit subsidies and partnerships. For example, the Selden Herring Smith Foundation and the Civic Mapping Initiative have really lifted up the fact that in some cases our campuses are not as accessible as they need to be to public transit. And all it would take is moving a single bus stop to make them more accessible. Just remember, every minute counts for your busy students. You might say that's only a 20-minute walk, but think if it was only a 10-minute walk or a 5-minute walk. In a few places, we're seeing some partnerships to get students into more affordable vehicles, but also more reliable vehicles. Remember, students can often get a cheap car, but it breaks down on 95, and they are not going to be in your class that day. Childcare, one of the biggest expenses that our student parents face. The latest data is showing 1 in 5 students has a child. I strongly believe that's a deep underestimate. I think that students who have children who are not their custodial children are not reporting. And I'm very concerned that that disproportionately affects men of color and that they are not getting the assistance just because the child doesn't live with them the majority or any of the time. They still take care of the kids. C Campus is deeply underfunded. This is an area for federal advocacy. Head Start, there's a new initiative coming out. I'm really proud to be the data and storytelling partner for the Association of Community College Trustees and National Head Start Association. Over the next year, you're going to see an invitation, if you're at a community college, to partner with your local Head Start to be able to bring a Head Start center onto your college campus. We think that this is not only going to create more support for people already enrolled in college, but we think this is an enrollment booster. It's also really good for the kids. We know about the effects of Head Start. On the health side, there's a variety of things happening. This is an area where it's very fast growth around things like telehealth and not a lot of evidence yet. Really hoping that we're going to see some rigorous evaluations soon to help us understand which of these programs is really working. Incredibly important to continue to push to get students. This is open enrollment time on the marketplace. We got to get students in there, and we got to make sure that they have health care. You will also see some new work coming out in the next year about ways that your colleges can learn how to better file for Medicare reimbursement in order to get funding for the health services that you are providing. Watch that coming soon, this new project from the ECMC Foundation and the Kresge Foundation. A couple other things we're seeing around financial aid. We saw emergency aid come out. There's now finally a conversation about these onerous requirements in federal financial aid known as SAP. SAP requirements remind me of work requirements in other programs and unfortunately create real tripwires. They don't raise students' achievement. In many ways, they actually just undercut students for making very rational decisions. I really hope that we'll all get involved in that conversation. You would retain a lot more students and you would retain more financial aid money to support them if we had more rational requirements. It's my opinion, and this is just Sara speaking, that SAP is an overreach on the part of federal student aid because it's crossing between financial things and academic things, and it's telling colleges how to engage with our students in ways that I don't think the department completely understands. I really think we need to push forward on that. Work study is a grossly, I don't even know what the word is. Work study is a mess. Work study is badly allocated. We don't have enough of it. And the places that need the most have the least. But also, I think a lot of us don't fully understand the strategic ways we could be using work study to help students meet the work requirements in SNAP. So even getting them a little bit of work study can help them meet that requirement for those that are not meeting the requirement through the other kinds of exemptions that you have established here. I do want to underline the importance of legal and tax assistance. This is something I'll credit Single Stop with putting really on our agenda quite a long time ago. We have a lot of students who are dealing with immigration issues, dealing with interpersonal violence issues, right? And they really need the support of an attorney, and they really can't afford one. If you can get legal clinics set up, this is a good activity for some of your law students, for example, and good partnerships with your community colleges. It can be a good experience all the way around and really help people. They also need help, by the way, with their landlords. Tax preparation and EITC assistance. Have you ever considered when students are running out of money in April, right? And the financial aid is running short and there's a lot of month left at the end of that money. How about getting them the earned income tax credit, which is refundable and can actually put a couple $1,000s in their pockets? And lastly, and this is definitely not least, culture change. I started by talking about faculty. You're going to hear me always talking about faculty because faculty are on the front line in every single classroom. And they are the ones doing assessment of your students, and they are the ones who send the strong messages about who belongs in college and who does not. Every action, every word that we take, every step we take in higher education, we're communicating to students whether they are good enough to be there. And I think that you're going to see growth of training for faculty. I'm really hoping. There's a new partnership happening between the American Federation of Teachers and a nonprofit called Believe in Students to try to really reach faculty with that message that every student deserves a faculty member who believes in them and who recognizes their talent. I think that's the other thing we should call ourselves, by the way, in higher ed. I think faculty should really call ourselves talent scouts. We see it first, and we have the ability to diminish it or lift it up. So, the other thing is policy change. I talked a lot about federal. I just want to say on the state side, and I'm talking here across the country, we're seeing a lot of advances across many, many states, not just California anymore. I'm really happy to see more East Coast and more Midwest and more states in the South coming to the table to talk about expanding students' access to public benefits. Also, having discussions about where dollars are flowing in the basic money that higher education gets. We have to talk about the fact that part-time students are full-time human beings. I'm going to just say that one more time. Part-time students are full-time human beings. They need basic needs and other supports, whether or not they take one class or 4 classes. And you're not going to get them, for the most part, to take 4 or 5 classes until their basic needs are met. And yet we're, for the most part, funding colleges and universities based on full-time equivalents, which do not treat part-time students like full-time human beings. We're also seeing more support, and I know we need more of it, for the infrastructure around basic needs. For example, basic needs navigators. We need staff. I also recognize that that means that at the institutional and also state agency level, we need staff there so that we can administer these programs and also evaluate them. Okay. All right, so let's talk a little bit about what works. I have a particular lens. I am a sociologist. I believe, however, that rigorous work can happen both qualitatively and quantitatively. The lens I'm going to use here is going to be primarily quantitative, where the evidence is available. And I say that because, for the most part, in order to create scale and policy change, people in this country need numbers. We count what we care about, and we care about what we count. So I'm trying to do my best to help you understand where we have counted and where we think things really are paying off. So let me start with basic needs centers and one-stops because they are not a new innovation. There's been a number of studies, particularly in recent years, in a range of places, from Arkansas to Amarillo College in Texas and Dallas, as well in Texas, North Carolina, and Pennsylvania. They take a variety of forms. In Amarillo, it's a homegrown one-stop center. In Seattle, these are one-stops on college campuses that are operated in partnership with United Way. In North Carolina, these were evaluations of single stop, which was implemented system-wide. We see a couple of things. The first thing is that every student who's getting help from a basic needs center, virtually all of them do have demonstrated need. And I don't mean that in a financial aid framework. I mean, it's clear that they need help, so that's good. People are being served who need help. But it's also clear that if we compare them to students who have needs more broadly, but don't use the centers, they are relatively advantaged. So, I'm going to talk more about this in a few minutes, but one of the things that we see happening is that it still takes a lot for students to find out about the centers, take the time to go to the centers and make use of the centers. It takes a variety of things, and those things are the things that already give them a leg up in terms of college completion. Until we address that, and until we also address the fact that almost all of these centers are deeply understaffed, and have far too little capacity to actually address the scope and scale of the problem, then I don't think we're going to see much progress in terms of their impacts. What we see right now is that there is a correlation, I can't say it's causation, okay, between use of a basic needs center and academic improvements. And in many cases in higher ed, by the way, that's about the best evidence that we have for anything. It's not like we're all walking around here with a lot of randomized control trials telling us that everything's working, right? So you can take that and say, yes, it is likely that if we do this, yes, we will likely see nice things on the back end. Maybe improvements in GPA, maybe higher retention rates, maybe higher graduation rates. But I will tell you that where we have run randomized control trials, we are not seeing positive impacts yet. And I attribute that to those serious implementation challenges that still exist. Now, on the positive side, we are seeing effects of meal vouchers. And this is a long time coming, and I want to give a big shout out to Pam Ettinger, who is the president of Bunker Hill Community College in Boston and has been on this topic for more than a decade. We worked together to raise money from a couple of places, the Kresge Foundation and the Boston Foundation in particular, to expand a program that she had been piloting for a while. And we did something extremely simple. We took $75,000 and we packaged it up for 100 students. So we said to those students at Bunker Hill Community College, you can have some money. It was really about $600 to $700 a student. It really wasn't a lot. But you can have some money so that you can afford to eat in the school cafeteria at the existing prices. These were vouchers, right? By the way, the cafeteria did not agree to lower their prices. So this was an average of $7 a meal. And they could get whatever they wanted, but at $7 a meal, they could go and eat there, and these were hot meals. We learned a number of things, and the study was led by Catherine Broughton, one of my former doctoral students. It took 2 years plus for this to pay off, for us to be able to see the results. The first thing is that it might sound like something that students would just snap really fast and say, yes, thank you, I'll take that meal voucher and start eating. Well, I went and visited the campus and started doing interviews with the students, and I learned that that was not the case. First of all, the students didn't really believe the staff who told them they could have these vouchers. In many cases, it took multiple phone calls from staff to actually get them to come get the voucher and believe that they could really use it. It seemed too good to be true. Secondly, many students were reluctant to use their vouchers on a given day because they were afraid that another day would be worse for them, and they wanted to save it. And this is a resource hoarding thing that we see from people who have lived with poverty for quite a long time. It's very, very common. It's very hard to overcome, to convince them that the money will be there. So they were rationing. And lastly, I really want to call out, because I think these students are extraordinary human beings that we really should understand from all perspectives. Many of them wanted to give that food to someone else. They didn't just have children, they had other family members, they had younger siblings, they had friends, and so if they were going to get a hot meal, they wanted to be able to share it. So in some cases, the students didn't put the food in their own bodies, they gave it to someone else. And while I do think we could probably detect some effects of that if we were looking, for example, at generalized well-being, or maybe even their child's well-being, we might not see that for their own academic performance. Nonetheless, we tracked graduation between the 100 students that we were able to fund and a completely matched comparison group. So we did literally flip a coin for this because we had so many students and only 100 could be funded. So we had a randomized control trial, and over the next 2 years, it kills me to say that the graduation rate over the next 2 years for the students we didn't fund was 1.41%. These are low-income, food-insecure students at Boston's largest urban community college. But for those with a meal voucher, it was 5.13. Those are actually huge effects. It's, of course, devastating that 95% of the rest of them still didn't graduate. But that right there is an intervention that pays off and that clearly has a high ROI, right? We're talking about $75,000 to get an increase in graduation rates that large. I will say I've also evaluated food scholarship programs that use food pantries primarily, and some food pantry work. We have not observed the same effects from those things. This makes sense to me in the context of the broader literature on what works with school lunches and also what works with SNAP. Students really need to be able to have choice. They need to be able to get a full meal, and there is something very powerful about being able to eat with your friends and family members. Another very exciting evaluation. I'm really hoping that Education Northwest, we're going to be able to release this report to the public this fall. I'm going to give you a look at some of the preliminary results that we've had, though, and this is a study that has been going on since 2016, if you can believe it. The Tacoma Housing Authority decided to address homelessness with Tacoma Community College, one of the most unaffordable regions of the whole country, by using Section 8 housing vouchers. So they set aside a number of their housing vouchers and decided that students who were homeless or near homeless could use those vouchers. Now, if you're not familiar with Section 8, Section 8 is well known as a really difficult program for people to use. Okay? And what that means really is that you get a voucher, if you're lucky, and you have to jump through a lot of hoops, including the HUD application. If you don't like the FAFSA, and I haven't seen better FAFSA yet, right? So if you don't like FAFSA, you really won't like the HUD application. It is really difficult. It's especially difficult for people who don't have all of their paperwork, IDs, pay stubs, all sorts of things. And then you have to go on the private market and you have to convince a Section 8 using landlord to rent to you. And we saw lots of problems there. So we followed them for a really long time and over about four and a half years. And this is a group of students who were given vouchers. Actually, they were given the opportunity to get vouchers. I really want to clarify that. It's a group of students given the opportunity to get vouchers versus a group of the same types of students who were not given the opportunity to get vouchers. Only 1 in 4 students offered the voucher actually were able to use it. 1 in 4. The overwhelming need for this program was among African American women, primarily with children. The overwhelming use of this program, you can already guess, right? Disproportionately white women. Okay? Who navigates the systems, who's able to actually get a landlord to rent to them, and so on and so forth. Okay. However, when we look at those two groups and we compare them, not just in terms of academics, and I'm going to come back to the academic part, we connected these data to some of the best data in the whole country for looking at human beings, the Washington State Longitudinal Data Systems. So we were able to see what happened to these students, not just on college campuses, but in the labor force. And to me, most importantly, we were able to see what happened to them with regard to their use of public benefits and to their health care. And so, for example, we were able to track them through the healthcare system to see if they had to go to the emergency room. We were also able to track them in the criminal justice system to see if they were convicted or charged with anything or committed a felony and so on. And what I can tell you is that offering these students housing and starting to work with them as navigators, whether or not they obtained housing, reduced the odds that these students had to go to the emergency room, reduced rates of inpatient hospital admission, which is extraordinarily expensive, and reduced the odds that these students interacted with the criminal justice system, felonies, arrests, and charges. We do not see academic changes as a result of this program. I believe that, number one, it hasn't been long enough. These are folks who've been through a tremendous amount of trauma. If we're talking about people who 30% of whom, without the support, were going to the emergency room over the course of a year for treatment, then we got a long way towards their well-being before we're going to see academic results. But I will also argue that this is part of our job of higher education, to bring these supports to students that reduce costs for our entire community, and also, of course, improve their lives. Let's talk about transportation. The average student spends 1/5 of their living expenses on transportation. The latest evaluation comes from Los Angeles, where they have a partnership with LA Transit, which offers students deeply discounted transit fares. A study led by Derek Price and his team at DVP Praxis did a quasi-experimental study, so pretty clean estimation, and they found that those discounted passes increased the odds of retention and graduation. Students earned more credits, and they finished at higher rates. This does appear to pay off. Emergency aid is something we're still learning a lot about. I think you're going to see like 18 studies of emergency aid coming out in the next couple of years because the pandemic created more emergency aid and more opportunities for evaluation. But I will flag that very early in the pandemic, we were able to do a small test of the effective emergency aid at Compton College, overwhelmingly, again, with a group of African American moms. And he wasn't able to distribute a lot of money, but Keith Curry was able to allocate $250 per student, and he was able to do it really, really fast. So the minute that they said that they needed it, he gave them $250. You would not believe it, but it almost doubled the extent to which those students were retained from May to September for $250 per student. He has now expanded that work, and I think one of the most interesting things that he's doing is he's giving emergency aid to dual-enrolled students. There's very little support that's often available for cash assistance for those teenagers, and they still have a lot of basic needs insecurity. And so there's a lot of things to experiment with. In terms of correlational analyses, there are a whole variety of institutions that are coming out with reports that say students who got emergency aid are more likely to retain in college, and some of you may have such reports. I will just caution that we can't establish cause and effect from that. Because again, in some cases, those students, even though they look low income and they have other challenges, are still the kinds of students who were able to navigate the system to get the emergency aid in the first place. Last little round out on research. There's a number of studies going on, some of them are in California, some in Colorado, about the effects of SNAP. I think we're going to learn a lot. One of the things that's going to be really important about that is they are using the state data systems in order to actually see students get SNAP. We need to move beyond, when we're working with students to get SNAP, just asking them to self-report whether or not they got it. Because it turns out those confirmations are very flawed, okay? And we're missing a lot. We really need to see those confirmations in the data themselves and be able to look at outcomes associated with them. Rashida Crutchfield in California is leading studies of rapid rehousing because the state of California funded rapid rehousing at college programs. There are also studies of place-based housing subsidies going on. As I mentioned, the Head Start on Campus study, emergency aid, and mental health. And I think that's going to be incredibly important for the use of your dollars strategically, especially as they become more scarce. A couple of observations I want to make across all of this information, right? And I know I just gave you a ton. I'm going to give you a resource at the end that's going to allow you with a QR code to see a link to a library where you can see all of these studies in one place. The thing I want to really note is that our basic needs programs are full of administrative burden. Now, I could say that about higher ed writ large. I could say that about a lot of things, right? But I just really want to highlight it, because if we're trying to understand education as liberation and education as important for thriving, we have to ask ourselves why we are saddling students with so much red tape. And the red tape, following my colleagues Don Moynihan and Pam Hurd, who are now at Georgetown, they classify red tape in 3 different categories that I want to draw your attention to. One type of red tape relates to what is required of students to learn about a program, right? I want you sometime to just Google the name of your college and basic needs and see if the thing that comes up is actually the access to the resources. Because that's what students do. They don't go on your website and then start looking around in there. They Google the name of your institution and basic needs. They need to see your program as a result. That is the most important thing you could possibly do. Also, it's hard for them to learn about eligibility criteria. We've been doing surveys for years and years, not only asking students what programs they're using, but asking why they're not using programs. And one of the top reasons is they believe they're not eligible. We have to clarify that. And most importantly, I think we should be communicating the message that you may well be eligible for SNAP, rather than SNAP is probably not going to fit for you. I think that's going to be probably more effective. A second type of red tape are what we call compliance costs, which means students have to do things to get the help. And they might not think about it. You might say, we don't have any forms, but there might just be wait time, right? If you accept the student's application or you tell them it'll come on a certain day and then they have to wait 48 hours for it, be the student. Think about being the student who submitted something on Friday and now has to wait till Monday morning to hear from you. I know that a lot of adults have to wait for things, but the stress of that on Saturday night when you're trying to figure it out and figure out if you're going to be there Monday can drive you right out of school. That's a compliance cost. The last thing are psychological costs, and boy, are they huge. It's the stigma that students experience, the stress that they experience going through the need to get basic needs supports. This is where culture change is going to be incredibly helpful. Now, a lot of times, the reason that you have these administrative burdens is because you are constrained too. The staff and faculty and administrators doing this work in higher education are also people. In fact, many of you, I don't know about those of you in the room, but it would be nice if we had emergency aid for you too, right? It would be nice if we could increase our mental health supports for you. It would be nice if you could get a real vacation without having to work during that vacation, right? All of these things would help students. I firmly believe that. I know there are skeptics who aren't yet sure that faculty and staff working conditions are student learning conditions, but I just think the science is lagging behind. That said, our response to capacity constraints tends to be putting more barriers in front of students. So for example, we don't advertise the program very well because we can't handle it if there are so many more students coming and asking us for help. We don't want to sit with the list of students who need emergency aid when we don't have the dollars to support them. I think it's a big, big mistake. That's not the right response. The right response is to generate that giant waiting list, use that to target them for other kinds of support that don't cost money, even just peer-to-peer support. Somebody reaching out and saying, I see you. I'm checking on you. I know the money's not here yet, but I'm checking on you. And use those waiting lists to generate more dollars. Show those to your donors. Be able to say things like, we have 27 students on Tuesday who we can't fund, and they need the money for housing, right? And describe them if you can, right? These are Pell recipients, or these are parents, or whatever else. All of this will help. I want to push your thinking with one quick exercise. Is student usage of your food pantry equitable? How many of you have a food pantry? Yeah, everybody has food pantry now. That's another way the world has changed. Okay. I want you to think, if you can, about the kind of data that you collect for the food pantry. First, I want you to think, do you track what we would call duplicated or unduplicated headcount? So a duplicated headcount is if you tell me that what I know is that last week there were 1,000 visits to our food pantry. But they could have all been by 100 students, right? If you got 100 students who came to your food pantry 10 times last week, you have a very different situation than if you have 1,000 students who came to your food pantry last week once. Very different. I think that one measure of success we should be working towards, and I know this is challenging, I think students shouldn't have to come to your food pantry more than once. Once. Because then they should be getting connected to other supports so they never have to come again. I've been thinking a lot about the toll that it must be taking on students to have to come time and time and time again to refill their bags. Second, do you examine user demographics? Now, some of you will say, no, we don't, because we don't ask students to sign in or otherwise disclose themselves because we don't want them to be stigmatized. And that's important. On the other hand, how are you going to ensure that you have equitable access to your pantry if you don't really know who's using it? I think that we're going to have to work very carefully to collect data during some periods of time while overall not asking for much, right? I don't think we have to ask every single student for all the information in order to figure out if access is equitable. But maybe for certain periods of time, we track some data so that we can take a pulse and just make sure that the practices are. And I'm going to show you what I mean by equitable in a moment. And lastly, when you think about compared to who? When you say your food pantry is working, the question's always compared to what? Do you think about their outcomes compared to all students? Compared to Pell recipients? Compared to students who are enduring food insecurity? That matters. And I'll show you what I mean. So let's say the question was, especially since I told you 35% of black students are experiencing food insecurity, are black students using the food pantry at equitable rates? So if you're the head of the food pantry, you might say, well, 25% of our food pantry users are black. And that's way higher than our student population. So yes, it's equitable. Okay, so the first comparison would be to all students. And that rate, percent black, is 8%. Sure looks like you have done equitable work, right? Very common. But if we compare to all Pell recipients, who we might argue would be at greater risk, they are not the only ones at risk of food insecurity, but at greater risk. Black students at your college, let's say, represent 23% of students. So now you have 25% at the food pantry, 23% among your Pell recipients. It's looking still equitable, okay? But still. But what if I told you that 40% of your food insecure students are black? And only 25% of your food pantry users are black. It's not looking so equitable anymore. You see that? It's harder to do this. Like, I'm not saying it's an easy exercise, you need the data in order to make the comparisons. But once you make those comparisons, things become a little clearer. And I'm not saying you're doing anything wrong, I'm just saying there's room for improvement. Right? And now you start asking yourself, why aren't we getting the rest of the students? What's going on? Okay? And what's going on in the broad category is there's a need for improved implementation. So in a moment, I'm going to give you a link to a rubric that Education Northwest developed after about a 2-year-long evaluation that they did with the ECMC Foundation of their basic needs grantees all over the country. And one of the things that I'm really proud of about that rubric is that it gets pretty specific. So I think it gets more specific, frankly, than anything we've done so far in hunger-free campus bills, for example, in defining what good practice really looks like. Right? And it's about the characteristics of that practice. It's not about what you do, it's about how you do it. So for example, basic needs resources need to be provided in a timely and accessible manner, with clearly defined systems to help students get to them. We need to be using approaches that reduce stigma, and I think many of you are probably talking about that. It's one of the most talked about areas of work. We need targeted case management to help students navigate, and we need technology systems that will allow us to do that. Okay? I am using Starfish Connect in my classes now, and that's sort of helpful. There's a notes field that I can write down things like my students said that they don't have enough to, pay their rent this month. But it's not triggering anything in particular, right, that says this is really a high priority and somebody else needs to look at it. And of course, we do need to be collecting in-depth student data and demographics. Now, a recent evaluation, the one that Ed Northwest led with ECMC, showed that if schools are getting it right, the primary area they're getting it right is around providing timely, accessible, and comprehensive basic needs resources. So that's 49% of the schools in that study. But only 24% were doing things to reduce stigma, 28% were providing targeted case management, and only 14% of the schools were analyzing student data and demographics. So that's a big area for improvement, right? The use of evidence. If we dig in a little further around what it means to provide timely and accessible things, we're talking first and foremost about leadership support. There are a lot of basic needs navigators working in isolation, often by themselves, one person in an office, maybe even just as a half-time job. And they don't really have the support from the top. And when they see policy changes that are needed, they don't have a way to navigate that themselves. We also know that having that dedicated office, as I mentioned earlier, was really important. And I do want to stress that almost no one is succeeding without external partners. This does not work. You're never going to have all the services you needed provided just by your school. What you can do, though, is open the door to your community partners. And when I say open the door, I'm not talking about sending students off campus to go use the help. I'm talking about bringing somebody on your campus and giving them office space so that they can meet with your students. And if you want to go one step better and you really want it to work, then you give them access to your data systems. And I know that's really hard, and I know we have FERPA, and so on and so forth. But there are ways to work this out. For example, in some places, what they're doing is they're putting that staff member at least part-time on their payroll so that they can count them as a staff member so they can put them into their data systems. Ways to reduce stigma. Simple online intake forms, if any form is required. No student should have to come anywhere in person in order to complete a form. I think those days are over. Student-led communication. You're going to talk today about basicneeds.nj.gov. If you want it to be used by students, then you need your student organizations to be talking about it. The peer-to-peer messaging is one of the most important and effective ways for students to learn about these things. And I would go well beyond student government. I would say to virtually all of your student organizations, this is relevant to your peers. Please tell someone. One of the most important things you can do, by the way, is say to somebody, not that I think you need this information, but I bet you have a friend you care about who might need this information. Right? That also reduces the stigma for them and activates their sense of purpose in helping someone else. Social work-informed case management requires the right mindset. It doesn't always require a social worker. Social workers are wonderful, and I love the idea of more of them being hired in higher ed, but I will also put in a plea for you to look at community health workers. Community health workers are increasingly doing basic needs work around the country, both on and off of our campuses, and most importantly, to be a community health worker, you don't have to have a college degree. So we can have people who have more lived experience with these actual challenges, get them on our campuses, and then provide tuition assistance to that community health worker who's doing basic needs work so that they can get their degree while working for you. That's a really wonderful pathway. It's going to be a much more inclusive pathway as well. And they cost less because they don't have as many degrees. Proactive outreach, equipping your basic needs offices with the ability to not only email students, but text students. Yes, texting. And by the way, they don't block you. I've done so many studies now where we've had colleges texting students, and every time we've heard, they're going to block us, they're going to unfollow us, they're going to tell us to stop. The opt-out rates are less than 3%. Don't be afraid of your students. Text them. Just make sure that it doesn't say like 17 words before it says, here's how you get help. Right? Say the word like food, housing, money available. Right? Take some tips from marketing. Right? Don't worry about it being too marketing-like, because that's actually what people respond to. And I already put in a plea for technology. We really do need it. We're really having problems, I think, at many of our campuses, being able to even say, for example, or report to the legislature how many of our students got housing services. If you're sending people to a community partner for part of that and you can't track that, you're going to be grossly underreporting your work. Okay, the data, I've explained a bit about what I mean about tracking students' needs relative to utilization. When you have that state survey data for your institution, you'll be able to say things like what are the compositional demographics, right, of my food insecure students, so that you can compare them. We need integrated data systems, and I think this is a call, frankly, not only for institutions, but really statewide. Those data systems in Washington State are miraculous, and they're going to help students. And when we start putting out briefs from our new analyses of those data systems, you all are going to want them. So I would start the conversations as soon as you can about not just integrating higher ed with workforce data or higher ed with K-12 data, but higher ed with your Department of Health and Human Services. In terms of evaluation is incredibly important both for improvement and for understanding the ROI. Surveys are good, I'm a fan, and we also have to admit they're burdensome. They're really imperfect tools, so we need to balance between the use of administrative data, right? If you can get some information about who's using your cafeteria, if you can get information about who's using your gym really early in the morning, right? Maybe to shower and so on, you may be able to develop some indicators of likely risk of basic needs insecurity without just having to ask the students all the time. I also firmly believe that one of the most important things we could do is put a very short survey in our LMS at the start and end of every term and ask students 3 or 4 questions about whether, for example, they have the food that they need to eat, whether they're struggling with housing, and so on. They log into those LMS more than almost anything else. I wouldn't make it a requirement for registration, right? Because we don't want to add another barrier to registration. But making it an optional question, I think that they will be glad that you asked. It will create more information to help you improve utilization and to assess impact. I promised you some resources. Here's your first QR code. If you can't use your phones to do this for the rubric, then you can just go to Education Northwest's website. The rubric is freely available. And I want to emphasize as well, in about 3 weeks, you're going to see a page go up on the Education Northwest website that's going to show you a lot of new basic needs resources and invite you to a free national community of practice on basic needs. Anyone and everyone is welcome to attend. We're trying to reduce the isolation that folks are feeling and bring you all into a virtual setting where you can make friends. I actually think friends in this work are so important, and make connections to help you do the work. So that's coming really, really soon. And we are also going to make the Real College Survey completely free to anyone who would like to use it by publishing a guide to it and the questions. I know New Jersey has its own survey instrument, but just in case that's also useful to your IR departments, that will be available to you as well. So watch that page. And then lastly, as I said, all of these studies and briefs about how to do this work, I have compiled all of this on my website in a free library. On that website, we have reports going back to around 2005 on basic needs. If you type in the words New Jersey in the search bar, you'll find our Real College reports on New Jersey, and you'll find related work that we've done together. If you want to see what other states are doing on homelessness, for example, then type in the word homelessness and see what you find. There's policy briefs in there. There's op-eds in there. One of the things you can all be doing together is just lifting up and educating your community on these issues. Take a look at the op-eds and see what you find. Okay? We want to equip you with as much help as you possibly can have because of how urgent this work is and of how many students need your help. Okay? All right. Thank you all so much for having me. This is so much fun. Really appreciate it.